Thank you, Mr. Chairman. Thank you to the organizers of the Penang Green Carnival for inviting me for this very meaningful conference on climate change. My topic of presentation is climate change and impact on health, right? Before we go to food security, food safety, and issues of food, right, which my other two speakers will target or zoom in on, specifically on food, my dimension of the talk is on impact on health, right? Health as a holistic thing, right? I come from the premise of being a medical doctor, right, with a PhD in environmental management, right? But more so, my premise today is as a member of the community, that's you and I, and also a concerned citizen of the world. Okay, right. Some of the key facts which you can extract from the WHO fact sheet on climate change is that is as listed in this slide. But before I go on to this, a single defining time was 1969 when the Apollo moon vision shot extraordinary pictures of our planet suspended in space, the blue planet. This is how we began to think about the biosphere and its limits, right? Just an object suspended in space. While our personal health may seem to relate mostly to prudent behavior, how you behave from day to day, your hereditary, your occupation, local environmental exposures, healthcare access, however, the health of the population, the nation, the region requires the supporting systems of the biosphere. The world's climate system is fundamental to its life support. In essence, climate change affects the social and environmental determinants of health. Not just food, it's clean air, safe drinking water, sufficient food, food security, and secure shelter. So between 2030 and 2050, that's way beyond some of our lifespan, climate change is expected to cause approximately 250,000 additional deaths per year. That's globally, yeah? From malnutrition, malaria, diarrhea, and heat stress. The direct damage to health, right, excluding cost to health, right, would be in sectors like agriculture, which is the third speaker's domain today, water, and sanitation. And it's estimated to cost between $2 to $4 billion by 2030. Many of you I see before me today in the audience, right, will be at your peak of your career at that time, right, 2030. So we wonder where our resources are going to go, okay? So areas with weak health infrastructure, mostly developing countries, hopefully Malaysia lifts itself by 2020 and becomes a developed nation because we are working very hard to put sufficient infrastructures in place, but much of the Asia-Pacific region, this region, Southeast Asia, and even Africa would go into the 2020s, right, and beyond as a developing country with weak health infrastructure. So if they're unable to cope, right, they're going to have the effects. Reducing emissions of greenhouse gases through better transport, food and energy choices can result in improved health, particularly through reduced air pollution. As we can see, humankind's activities are altering the world's climate. We are increasing the atmospheric concentration of energy, trapping gases, thereby amplifying the natural greenhouse effect, right? What are the greenhouse gases? Yesterday's lectures gave us, right, mostly enumerated, the speakers enumerated the greenhouse gases as carbon dioxide. Where do we get the carbon dioxide in the atmosphere from? It is from fossil fuel combustion, the cars we drive, and from forest burning, and other heat-trapping gases, such as methane, from irrigated agriculture, animal husbandry, and oil extraction. The other greenhouse gas, nitrous oxide, and human-made halocarbons come from things as mundane as your air conditioning units and so many other chemicals which we use today. Climate change. Over the last 50 years, right, to reiterate, right, over the last 50 years, human activities, what you call anthropogenic activities, particularly the burning of fossil fuels, have released sufficient quantities of carbon dioxide and other greenhouse gases to trap additional heat in the lower atmosphere and affect the global climate. Right? We need the greenhouse effect, but we don't need it in such levels that the environment heats up. So much so that in the last 100 years, the world has warmed approximately 7.5 degrees centigrade. That's enough to kill off much of the flora and fauna in our biosphere. Each of the last decades has successfully been warmer than any preceding decade since 1850. With this warming, glaciers are melting, precipitation patterns are changing, sea levels are rising. Extreme weather events are becoming more intense and more frequent. The global scale of climate change differs fundamentally from many other familiar environmental concerns, right? When we talk about public health, some of you will go on to do medicine, we look at causality of disease, right? And when a patient comes, you look at localized toxicology and microbiological hazards which may cause disease. However, climate change signifies that today we are altering the Earth's biophysical, ecological systems at the planetary scale. How do we even measure that? I'm a public health physician, right? I'm a doctor. Can I ever decipher whether a patient coming to me is suffering from the ill effects of climate change? Okay? The impact, What is the impact of climate change on health? Although global warming may bring some localized benefits such as fewer winter deaths in temperate climates, it's good, right? The cold climates, they will have warmer winters. If you read, and I think many of us have smartphones today, if you read at the climatic, or look at the climatic scenario of weather patterns, right? The temperate areas are recording warmer climates. Well, it's nice for the citizens because they feel warmer, but the summers become extremely hot, right? And in temperate areas with increasing weather patterns, there might be increased food production in certain areas. Overall health effects of a changing climate are likely to be, but overall changing climate are likely to be overwhelmingly negative, right? Because if you look at the determinants of social and environmental health, right, our air will be affected through this pollution, right? Our water will be affected, our food and our shelter will be affected. In the first instance, you will have extreme heat. Extreme high temperatures contribute directly to deaths through cardiovascular and respiratory diseases. I wonder whether you read about, just as recently as 2003, not recently, a decade ago, right, there was a terrible heat wave and it recorded 70,000 excess deaths. hospital admissions increased, right? The high temperatures also increased the levels of ozone and other pollutants in the air that exacerbate cardiovascular and respiratory disease. With increased temperatures, the pollen and aeroallergen levels are also high in extreme heat. They can trigger diseases like asthma, right, which affects around 300 million people. Ongoing temperature increases are expected to increase this burden. So it's basically cardiovascular and respiratory. Natural disasters and variable rainfall patterns will also change. Right? Globally, the number of reported weather-related natural disasters has more than tripled since the 1960s. Every year, these disasters result in over 60,000 deaths, mainly in developing countries. I wonder about the 1990s. Many of you would have been born by then, right? In 1990s, we had the Genting Highland disaster, landslide, okay? Was it due to excessive development or excessive rainfall, which caused the earth to be very loose and, it could cause damage to that? The Genting Highlands landslide, that was another episode. And in 1996, 1998, we have been having recurrent haze episodes. So it is in our lifetime that you and I are seeing, right, what variable patterns climatic events are causing. Okay, so more than 60% of the world's population reside within 60 kilometers from the sea. Don't you think we should be concerned about rising sea levels and extreme weather events that may destroy homes, medical facilities, and other essential services? Right? People will be forced to move. In turn, heightens the risk of health effects from mental disorders to communicable diseases. Increasingly, variable weather patterns, rainfall patterns, are likely to affect the supply of fresh water. It is predicted by 2090s, climate change is likely to widen the area affected by drought, double the frequency of extreme droughts, and increase average duration sixfold. This is 2090, right? Should it be our concern? Well, today we are already having the threat of water rationing, right? Some of us are experiencing water rationing. This will only become more frequent, right, as the phenomena become more frequent. Floods are also increasing in frequency and intensity. If you read the recent papers, look at the Himalayan regions of Pakistan and northern India, right? They've been having, and these are developing societies, right? Rising temperature and variable precipitation are likely to decrease production of staple foods in many of the poorest regions by up to 50% in 2020 in some African countries. Patterns of infection. This would be the pattern of the reason to cause anxiety among many public health physicians. Climatic conditions strongly affect waterborne diseases and diseases transmitted through insects, snails, and other cold-blooded animals. Changes in climate are likely to lengthen the transmission seasons of important vector diseases to alter their geographic ranges. I wonder whether you know about zoonosis. Zoonosis is the use of vector-borne diseases. So how would climate change affect? Right? By warmer temperatures and increased precipitation and rainfall, you will have abundant areas for vectors such as the Anopheles mosquito and the Aedes mosquito to thrive, to increase their populations. What has happened now is these diseases have prominently been centered around the equatorial regions. But as the weather patterns increases and the temperatures heat up, right, the dengue cases are going more and more towards the tropics, right? They are expanding the band from just the equatorial areas towards the Tropic of Capricorn in the north, south, and Tropic of Cancer in north. As recent as a week ago, Japan, they were in a panic mode. They reported cases of dengue. Right? The last time was maybe during the World War, or before the Second World War. Right? So the Minister of Health in Japan had come up on BBC and CNN and said that this was a climatic event for dengue to be spreading. Malaysia, the cases of dengue has increased exponentially. In the first quarter of this year itself, mortality, which is deaths, and morbidity, which is hospital admissions or cases of dengue, outweighed or became more than 1 year before. So it will just keep on increasing. How do we measure? Well, the measurements of health effects of climate change are at the most approximate, right? You have to look at the human exposure, you have to look at the modulating influence, right? You have to look at the contamination pathways, the transmission dynamics, changes in the agroecosystems, and the socio-economic and demographic disruption. It is through measurement of all these things that we can look at the health effect. Right now, the WHO has, through the assessment, they have developed models, right? And they have developed models to actually project how much, and that's where we are able to come up with figures, such as what the projection is. I seem to be reversing. Okay, now, in this session alone, we need to know who is at risk of climate change. Right? When we talk about a case like chickenpox, you can keep your kid away from school. You don't, it's a contagious disease. You just isolate your children, okay? If you talk about influenza, you wash your hands. You can take immunization shots and all that, right? But how do you protect yourself against climate change? All populations will be affected, irregardless of race, creed, everything, right? But some are more vulnerable than the others. People living in small islands, developing states like the Maldives, right? The Prime Minister of Maldives, the previous Prime Minister of Maldives actually held a cabinet session underwater to bring the world's attention to what was going to happen to their atolls. The country may cease to exist if the effects of climate change are not So what would that entail? Okay, then people in coastal regions. Look at Malaysia. Malaysia is a peninsula. We're surrounded by sea tree sites. Penang is just surrounded by water all over, right? So we are very, very vulnerable, right? We are a maritime nation. We have to take cognizance of the fact. Okay, mega cities, mountainous, you think that it's only the coast? Mountainous and polar regions are also vulnerable. Remember, I talked about the melting glaciers, right, and ice caps? That's going to expose those populations there. Children, in particular, children living in poor countries are among the most vulnerable to the resulting health risks and exposed longer to the health consequences. And areas with weak health infrastructure. At the rate Malaysia is going, hopefully, we will have sufficient infrastructure, but we have to look at the geographical terrain and figure out. Okay, so public health research would be important because it would look at accessibility of vulnerability and adaptations. Okay, WHO has come up with several responses, right? But there's a lot of individual choices involved, right, to reduce greenhouse gas transmissions and produce major health benefits by reducing, right, vehicular use of and increasing public transportation. You will also have more active movement, such as cycling and walking. That will reduce carbon emissions by reducing fossil emissions, right? It'll cut down the burden of household air pollution, which causes 4.8 million deaths per year from ambient air pollution, right? Okay. Extreme, I've gone back, huh? Okay, what is the impact? Sorry, I'm going somewhere else. Okay, right. In 2009, I was hitting the wrong button. In 2009, the World Health Assembly endorsed a WHO work plan on climate change, which includes advocacy to raise awareness that climate change is a fundamental threat to human health. Partnerships to coordinate with partner agencies within the UN system to ensure that health is properly represented in climate change agenda. Science and evidence to coordinate reviews of the scientific evidence on the links between climate change and health, and develop a global research agenda and health system strengthening to assist countries to assess health vulnerabilities and build capacity to reduce health vulnerability to climate change. Now, one of the things which WHO has projected or requested member countries is to come up with national environmental health action plans to look at the whole holistic dimension of health, not just from climatic events or climate change effects, but also from individual health and well-being, right? NEHABs are comprehensive, holistic, and intersectoral way of planning and implementing environmental health action plan. Right? When I was first introduced to the concept of what environmental health was, I thought it meant the health of us, human beings, as with regards of what the environment could do to affect our health. But when I went for WHO to South Australia and presented my topic, the scientists there reiterated and said that first you look after the health of the environment, the ecosystem. Only then can our health thrive. So it's a pun on the word environmental health. Is it the health of human beings or health of the ecosystem? It's a dynamic process. Well, Malaysia has come up with a NEHAB, right, where we look at areas of concern, such as in this morning's session, hazardous waste management, and these are some of the government departments and ministries looking at it. And you look at rural water supply and sanitation, we look at recreational water, we look at safe drinking water, we look at air pollution, indoor and outdoor, we look at sewerage and urban sanitation, look at solid waste management, food safety and security, occupational health and safety, soil contamination, right? These are all emerging issues when you look at each of these things with regards to public health. Let me share with you the next few slides. I've got about 5 minutes, right? The next few slides, let me share with you some of the models I have developed over the years to explain or educate myself, and I would like to share with you to look for you to take into cognizance, right, when you need to have a role or play a part, okay, because each of us as individuals, as communities, and as a nation has a duty to look after not just ourselves or our families, our homes, but also the environment around us. So if you take a natural setting, right, look at the natural setting, be it your house or your neighborhood, and you determine the values to it. Then from the values, you see how valuable it is? You establish criteria. What is it you can do to enhance or maintain or sustain the value of your place, right? If need be, as a community, you can ask your Rukun Tetangga to undertake an assessment. If it meets the criteria, you protect it, right? If not, you have to look at environmental impact assessment or health impact assessment, right? If it doesn't meet the criteria, you have to remediate, okay? If, like in Kuala Lumpur, there is this area called Gasing, okay? It has been overdeveloped. So the residents have gone in and asked their local authorities to remediate, looking at the cost and effect, right? And to control and protect the environment they lived in, right? So if, as each of us increase our educational comprehension and capabilities, I think we could generate action. Going further, this is a very bad slide, right? But basically, slide stakeholders. On one end, you have the local entities, and there's a whole list of local entities here, from the local authorities, the inspectors, right, the local departments and all that. And at the other end, you have the central agencies, which are central government agencies and all this. And the balancing act is, you look at the global think tanks, like the United Nations and all these other bodies, okay? Malaysia is a signatory to so many of the conventions, treaties and all. You, as a knowledgeable citizen of the country, must take cognizance as to where it involves you, right? And the environment you live in. And you have to strike the balance between your local environment and the biosphere we live in. Okay, let me reiterate in putting it to a specific environment, okay? If we look at water, right? This is a recreational water pyramid, which I created during my dissertation, where you take right from the hills, or the top of the pyramid, is the fresh water coming from the hills, okay? From the rain to the hills, right? You come down the tributaries, rivers, into your springs and all that, and you go to the brackish estuarine water, right, where your mangrove swamps are, and you come to the ultimate coastline, the marine environment, the ultimate sink for all the human activities, right? Why it's important is whatever happens right at the peak, don't say it doesn't affect you, because that is the catchment area, right? What happens up there comes down into your reservoirs, right? And it's processed, and it comes through the tap, and you drink that water. So you need to educate yourself. So looking at a simple thing as a pyramid, and my area was looking at the coast, okay? Penang is surrounded by coast, okay? Like I said, taking a natural setting, look at who are the types of users. So what I have here is an octagonal web of coastal users, where you have the local community, you have the global community, the local community, right, the groups and individuals, from outwards to the individuals, okay? And octagonal, you have the full extreme of ages, from youngsters, from babies, to the very old. And the types of activities, like when you go to the beach, right, you can either sit there and just look at the sea, having no contact. You can have minimal contact by strolling on the shoreline. You can have a reasonable contact by swimming in the sea, and you can have full body immersion right? So, if the sea is going to be the ultimate sink of human activities, right, and you are going to be involved, I mean, you're going to be one of the users, whether you have no contact, pencemaran air laut will ruin your holiday, right? You drive up all the way to your coastal area and you see black water. That's not the way to go. Okay, so looking at the users and then looking at the uses. Remembering, I said you put the value, you put the criteria. When from the land to the deep sea, what are the types of uses you have for your environment? I'm giving an example of the coast. You can give it even in your kitchen, even in your garden, right? You can do the same thing and try to figure out, because it's all about causality, right? If you can establish a cause, then as a concerned citizen, as a member of the community, you look at what are the global initiatives, what are the related international treaties, intergovernmental bodies, law of the sea convention. I mean, this is looking at coastal areas. You come up to the regional initiatives, and you come up to the agreements, the transboundary issues. After all, the haze affects you, doesn't it? So you need to know what are the transboundary issues. Then you look at the national goals, and then you look at the state programs, and finally, you look at the local action, right? Under the local agenda 21, it is to motivate everyone to have a stake in the planet we live in. So, in essence, in just 30 minutes, right, I have sort of like given you what the impacts are. Okay, we can look after our health. What they say is hereditary loads the gun. Okay, we are born with certain traits that we cannot do anything about, but environment pulls the trigger. So where you live, right, how you live, risk behavior, all these things are so important. So let us preserve life on earth through our positive thoughts and actions. Thank you.
Thank you, Dr. Sumitra, for the insightful overview on the topic of climate change and the impact of the health. Actually, just now, it's not, sorry for the, apologize for the insufficient mentioning about the climate change and the health. I see the interlink between the biosecurity and the health. And she also provided very good guidelines and initiative about what we can do individually as a community or nation about the climate change.